Wednesday, and ladies and gentlemen, look who is here. Time to talk a little wellness and time to talk a great smile, because the lady that can create a great smile on your face is here with us right now, Dr. Steffany.
Before we get to dentistry, we have to talk about meteorology real quickly. National Weather Service, a severe thunderstorm warning for Adair and Adams County until 9:45. Quarter-size hail would be the threat.
Oh, really?
Whoa.
That'll be in the neighborhood of Corning itself here, coming up, well, it says somewhere here at about 9:12.
Would that be heading our way?
9:45. Eventually. It's not a very big storm, but there's a little bit of hail in it headed toward Corning right now, maybe up to quarter. So folks in Corning, keep that in mind. I apologize.
No.
I don't know if
it's
teeth can experience hail damage if you smile into the sky. If we can connect this somehow.
Enamel is pretty tough, so you're probably okay.
Yeah.
Oh, okay, good to know.
Yeah, enamel is the hardest substance in the human body.
Really?
What?
I didn't know that.
Yes.
More than bones? Or is it
more than bones?
Wow.
And now do this. Do that. More than bones.
But we're here just in case a piece of hail did hit your tooth and knock it out. Just in case that happened. What are you going to do if you're missing a tooth? What are the options do we have?
Well, so this is great. It's a great discussion because a lot of people don't necessarily know what the options are, and so there's kind of layers or levels almost. You can have something that comes in and out, something that's removable, so a partial or a denture if you're missing a tooth or teeth. You can have a bridge, which is basically like a bridge, like you have two teeth and they support something in between. So
and that's a permanent structure?
It's a permanent, yep, it's cemented in, something that goes in between two or more teeth to replace one. And then you can have what's considered to be, the top level would be an implant, where you're missing, one or more teeth, and you replace with a, for lack of a better term, a screw that goes into the jawbone.
That's what it is.
Yes, that's exactly what that is. It's a post, yes. It looks horribly painful, believe it or not. The bone does not have nerve endings. It doesn't have feeling, really. So the gum tissue over the bone will have feeling, but the procedure is not painful. And so people say that over and over and over and over again. So once you get a little bit numb and we put the post in or the implant in, it's not a painful
Open
thing.
up your mouth, Jason.
So how do we go? Where do we go from filling to crown to implant?
Where do you go?
Like what are the levels there? So filling, you got a little thing.
Yeah.
A crown, you got big trouble, and then.
Yeah, a filling is it's structural. It's like it's like you're building something. So if a tooth has a piece of it that's soft, that gets soft, you put a filling in it to replace the soft tooth structure and arrest the disease that's in there. So something is trying to eat away your tooth, you put a filling in. If you have enough structural damage that you have a big chunk of the tooth missing, and either the tooth falls apart or we're afraid it's going to fall apart, then you put something over the top of it to hold it together. A crown is sort of like a vice. Not really. It doesn't feel like that, but it's a cap. I mean, people call them caps for years because it kind of caps the tooth and helps it to stay together. And then if you lose the tooth, then that's when we would go to some kind of replacement with an implant. So. Yeah.
No, I've had the part done where you put the post in for me, and I think next week I get scanned. And you're absolutely right. I would much rather have this done than get a filling. I mean, it's so easy.
It was so easy. Yeah, it is. And one tooth especially is really, really easy. A lot of times people are missing all their teeth, and then we can put them back.
Are those all implants on the right?
On the top, yeah.
Really?
Yeah. So. A lot of people that have been missing their upper or lower teeth for a long, long time and had dentures, then we put something in to replace that.
Look at that.
Oh my! Talk about a difference.
That's what's really fun about what we do, is that it really does make a huge difference in people's lives. And people that don't smile and then they change and they smile, it's big.
So what's the difference between that and like veneers?
Veneers are when the teeth are present and there's something that you don't like about either the shape, the color, or the size of the teeth, and then the veneers go over the top of the teeth.
Over the top.
Yeah.
Okay.
Yeah.
Yeah. Look at even these. A
lot of people consider veneers to be sort of like fake fingernails. Only it's living tooth structure. I mean, your nails are kind of dead, but
Okay.
Yeah.
So you put the post in. You've got to somehow. I think you use some sort of a 3D scanner.
Yeah, we do. Mm-hmm.
To build the model for the tooth.
Correct. Yeah, we do a digital scan of the tooth. Yeah.
And then do they mill the new tooth nowadays?
A lot of times the crowns are milled now, and it's nice because they're a lot more precise because they're milled instead of. I mean, not that the people that used to make them in a little sweatshop lab weren't great. They're really, really talented at what they do, but it takes about 10 years to really become proficient to make crowns crowns and some of the things that we put in people's mouths. With digital technology, it can take 10 weeks to train to do a milled crown instead of actually waxing up a crown and making a new crown. So.
And then you literally screw it in like a light bulb.
You screw it in or cement it in, either one.
Okay.
Yeah.
Gotcha.
Yeah.
So cool.
Yeah, it's cool. It really is. It's very life-changing too. An implant feels like a tooth. Something that, the partial or a denture that comes in and out, it's never going to feel like a tooth. It feels like a bunch of stuff in your mouth, or people say that all the time. I hate my partial. It comes flying out sometimes when I try to talk. Or like my bridge, I can't floss underneath it. So we treat implants. We treat the area like a real tooth would be.
And that would be permanent.
It's permanent, yeah.
Okay.
It's
What's the warranty on one of those things?
The warranty. The great thing about implants is it is the most permanent thing that we can do, because the bone, this is what's really great. Once we place that post or the implant into the bone, there's a process called osseointegration. So osseo meaning bone and integration, and the bone actually fuses to the titanium implant.
So it's going to grab onto it.
It's like it's putting a post in cement, basically, is what it is. And it stays permanently, unless you do something really wacky to it or don't clean
And we
around
should
it
mention, you're not one of those people who would say this because you're not all full of yourself, but you actually teach other people how to do this.
Oh yeah, I do. Yeah, I teach classes. Yeah.
So
yeah.
that's a feather in your cap.
Now, what happens
thanks.
in the unlikely event something you get hit with something?
I love telling people what to do.
And you get
Brush
hit
your teeth.
in the face, and what you just put on there, that it breaks or chips or
that can happen with a regular tooth or with really. It's funny. This morning, my the door stop that screws into the wall. We have children, right? So anything can happen. And so it was sheared off in the wall. And I looked at my husband and I said, that's kind of like teeth or implants in it, because you either have to decide to dig it out or you have to decide to work with it or put a hole in someplace else or something like that. So.
But can you pop it off and put a new one on?
Strange,
a new tooth on top of where that post
Sometimes,
is?
yeah, lots of times you can. Yeah, so the implant has a channel in it that you screw things into, and then that becomes your platform for building a tooth. So.
Now, if I feel like I need more swag or bling, can you do gold in there?
Ooh, I think that would really
like
do
a diamond
well
encrusted
for you.
tooth.
I think that'd be very nice. Yeah. You're never going to be a pirate, though.
No.
Yeah.
No.
No, JP on.
Yeah, little monogram on there.
You're probably too old for that.
Think so?
Yeah.
All right, so people want to get any kind of bling like he's talking about, or get anything else done dental-wise, how do they get a hold of you?
Yeah, no, we would love to see you. Our best way to find us is dmsmiles.com. Our website has all the information to find us, and people actually even do sometimes find our location, which is really nice. But we're on Jordan Creek Parkway, and our number is 612-7148.
Yay!
There you go. Dr. Steffany, thank you.